Good day, everyone, to our online audience for today's European Observatory webinar series on health systems performance, where we wish to showcase for you a special issue on health systems performance assessment that we co-edited together with WHO in the journal Bulletin of the World Health Organization. Today's webinar will be specifically focused on data coming from people, from their subjective views and experiences, and perceptions, as an integral part of performance assessment. That's why the title of today's webinar is People and Performance, Capturing the Population Perspective on Health Systems Performance Assessment. We have a fantastic speaker lineup today. They're all co-authors of the article in the special issue on this topic. The article title is Population Assessment of Health Systems Performance in 16 Countries. We'll put the link to the article and to the special issue in the chat box for you. The lead author, Margaret Kruk, will give us an overview of the People's Voice survey. This is a survey which specifically looks at a representative sample of a country's adult population, so both users and non-users of health services, to capture a broad spectrum of public opinion on health systems performance dimensions like quality, like access, like people-centeredness, like responsiveness of the health system. So she will be giving you an overview of this survey and presenting some results from some of the European countries where the survey took place. After that, we have 3 spotlight speakers whom I'll introduce in due course, and they will collectively cover People's Voice Survey, PVS, results from Greece and Romania. The surveys in those countries were conducted in collaboration with the WHO Athens Office on Quality of Care. And the final speaker, Gunther Fink, will speak on to ongoing data collection for the PVS in Switzerland. Now, not to preempt what Professor Margaret Kruk will be presenting, but the uniqueness of the PVS is that it takes a representative sample, as I said, of the adult population to understand not only user perspectives, but also non-user perspectives, how both the population perceive the health system. So it really nicely complements a number of other surveys that we have here in the European region, like the Eurobarometer survey, which is a population-based survey, although not particularly focused on health. There are many health-specific questions there. There's the OECD Paris survey, which was launched, the results of which were launched just last week, and that's health-specific, focusing on patients and provider-reported data. So let's get right in. Dr. Margaret Kruk, our keynote speaker, is a distinguished professor of health systems and medicine at Washington University in St. Louis, where she recently moved to from Harvard. Prior to Harvard, she was at Columbia University and University of Michigan, before which she practiced medicine in Canada, where she received her medical degree. Dr. Kruk leads currently the Quest Global Network, which runs the People's Voice survey. So let's hear all about it. Over to you, Margaret.
Thank you so much, Deepa, and delighted to be with everyone today. Yes, we're excited to share with you a little bit about the People's Voice survey and a little bit of an inkling about what it can tell us about health system performance. Next, please. So the survey is grounded in the work of the Lancet Global Health Commission on High Quality Health Systems. This commission took a hard look at healthcare systems around the world and concluded that a high quality health system in any context, a low, middle, or high income country, does 3 things well, should do 3 things well. And those things are consistently delivering care that improves or maintains health, generating a sense of value and trust by the population, and being able to respond and change when population needs change. So next, please. The 30 commissioners from 18 countries that comprise the commission really held us to a high standard in the analysis and the recommendations of the commission. And I had the great honor of leading this commission. Next, please. So the commission's measurement recommendation is the one I want to focus on with us today. We took a look at the way that health system performance and quality are measured. And we concluded that health systems should focus their scarce resources for measurement on reporting what matters most to the population. And those elements are competent care and systems, the experience of users, people in the system, health outcomes, and also confidence in the system. Next, please. How do we measure performance today? I think around the world, there are many different elements that we look at when we think about, is the system working well? We hear a lot about workforce and doctors per capita. We certainly care a lot about facilities and infrastructure, hospital beds, and so on. We routinely speak about health spending. And of course, we also measure population health, which is critically important. Utilization and efficiency are other kinds of measures that we use routinely. But what I want to point out is a lot of this perspective on system performance is from the supply side, the system side. I think the thing that drove us in our work on the People's Voice survey was the question of how do health systems work for the user. Next. So that brings us to a core question that I'm often asked when we discuss the People's Voice survey, which is, why do user perspectives matter, really? I think there are three big reasons why they matter. The most important is that users are co-producers of health with the health system. Doctors' advice and medications do not cure people if people refuse to take them and refuse to follow the advice. That we need people's insights to guide improvement of their own healthcare and improvement of healthcare as a whole. So health outcomes cannot improve if people do not, in fact, give us perspectives on the health system. Second, and importantly, people pay for the health system. There is no universal health coverage if the population decides not to contribute their taxes or premiums to the pooled funds for universal health coverage. And thirdly, we have a lot of discussion, and certainly WHO has led this discussion, that health systems should be people-centered. And it struck us that actually, given that ambition, there are very few measures that are truly people-centered. Next, please. So what is the People's Voice survey? The People's Voice survey aims to promote accountability, inform improvement, and also track change in the health system. We have done the survey now, actually, numbers are increasing because data collection is ongoing, about 21 countries to date. And we do it typically through the telephone, or in some countries, particularly higher income countries, online from nationally representative samples. What's important to note about the People's Voice survey is that the content is meant to be adaptable to all countries and health systems, with, of course, some adaptation work locally. Next, please. I won't go through every step of the development and testing of this survey. We took about 18 to 20 months with a global development group to review the survey literature, develop drafts of the survey based on what was out there, and making sure that this survey added a unique dimension of information. We had external consultations, and then a substantial amount of cognitive interviewing in different contexts, low income, middle income, high income countries, to make certain that people understood what was being asked and that the language of the survey could be adapted to people's education levels and experience levels. Next, please. I already mentioned that typically the People's Voice survey is a phone survey with a live interviewer using random digit dial, the most common approach to get a nationally representative sample of adults. As Deepa said, these are not adults who have necessarily used the health system. They are both users and non-users. Indeed, one of the cardinal indicators of the People's Voice survey is the percentage of the population who has used the health system in the past year. In areas where we have low phone ownership in lower income countries, such as rural Kenya or Ethiopia, we have done face-to-face household surveys. And in certain countries where people do not pick up their phone at all, and it's very difficult to get phone surveys done, we have used web-based probability panels where participants are recruited to represent the population. Sample sizes are between 1,000 and 2,000 people per country. And we have done, there were countries in which we have translated the survey in up to 8 local languages in that one country. So translation and adaptation and testing are huge parts of the People's Voice survey. Next, please. Okay, so let's dive into some of the results. There are a lot of little circles on this graph in front of you. What I want to do, let's go to the next slide, please, is zoom in on 3 countries. Greece, Italy, and the United Kingdom, countries in Europe that we're focusing on today. And I want to share with you just some of the data that the People's Voice survey contains. This particular slide shows how people think about the quality of their healthcare system, in particular, the quality of their own care, the experience that they have in the healthcare system, the respect, for example, that they got, and access. So the purple areas in these slides for Greece, Italy, and the UK tell us about access. And those are questions around, do you have a primary care provider? Do you use healthcare when you need to? Is there a time in the past year where you've had an unmet need? So if you look at the purple slices of this pie, you can see that the purple areas extend the furthest of all the different colors, showing us that access to care in Greece, Italy, and the United Kingdom is actually quite high. So for it to be full access, the purple would have to extend all the way to the outer ring, and we're pretty close to that in the three countries. Now let's look at the yellow. Yellow indicates the quality of the person's own healthcare. And what you see in all three countries is one of the yellow slices shows us that people's own providers rated quite highly. But then the other yellow elements are actually the quality of public primary care in the country. And what we see is that those ratings are much lower than people's own primary care. So when people look around, what they see is a system that they're not particularly approving of. And what we see here is that in the UK, for example, the primary care slice, which is kind of the medium yellow there, rates higher than Greece or Italy. Now, orange tells us about user experience. So user experience are things like respect, the voice, and customer service that you feel when you're obtaining healthcare. And what we found very interesting in this paper is that Greece, a country with the lowest health spending among these three countries, reported the highest respect, voice, and customer service, followed by the UK, and in third place was Italy. Next, please. I want to share just a few findings too about, I think, what is a very important and a hot topic, which is user confidence in the healthcare system. So we report this in the bulletin paper, but we also have another paper in which we delve more deeply into confidence. So briefly, why does confidence in the health system matter? Confidence, of course, is that feeling that you can trust someone, rely on something, rely on the health system. Population confidence is central, we hold, to the success of health systems because it promotes uptake of needed care. It promotes a trust in a social institution. And we know that trust in healthcare increases trust in governments and increases social cohesion. And back to the argument I made earlier, populations need to feel confident if they're going to agree to pay for national health systems. Next. And in the survey, we measure confidence in the health system in two different ways. I'm curious to hear folks' reaction to this. Confidence is comprised of the feeling of health security. Are you confident that if you're going to become very sick tomorrow, that you can get great quality healthcare and afford it? So this is a sense of health security, a definition first proposed by the United Nations Development Program in the 1990s. But another element of confidence is the sense of endorsement or support for the health system. That has two elements. Does the system work well today? And also, is the system on the right track? And that's what we call the direction of the health system. Next, please. So here I want to focus in on what we found on health security, which again is that feeling that if you were to get sick tomorrow, you will get the healthcare you need. I just want to pause on this concept for a moment. It struck me throughout my career that of all the demands that people make on health systems, this is one of the most fundamental. People, of course, care about prevention. People care about minor injuries and illnesses. But really what people want to know is that if something terrible were to happen to them or their family, the system will do their best to save their lives, to treat them and to care for them. And so this notion is, I think, an essential part of the social compact between populations and health systems. So what do we find when we look at health security? So this is now looking at data across 15 countries. And what we see is that overall, across these countries, ranging from low to high income, half of respondents in those countries feel that they can get and afford very good care if they got sick tomorrow. Now, what we see in the European countries is actually Italy leads in this indicator. So Italians feel most secure in their health system among the European countries participating. With the UK, only less than half the population feeling health secure. And Greece has the lowest health security at 21%. So now just remember the Greeks in our survey responded they had good customer service, and yet they were able to distinguish that customer service from a sense of the system not necessarily being adequate for them should they need more serious care. Another important point here is that affordability in most countries received lower ratings than people's ability to find good care, which I think makes a lot of sense. Everyone knows a great hospital. I think many people are worried how they would afford it. Next, please. Endorsement. So this is another very important indicator. If I were the finance minister, the prime minister, the health minister of a country, I'd be very concerned with this indicator, which is the extent of support for the current health system. So what you see here is two different bar charts. The first is the direction of the health system. So how has this health system been doing in the past 2 years? And what you can see is that the European countries are circled in red. You can see that very small minorities of Europeans, Greeks, Italians, and Britons in this survey felt that their health system was improving. That's what the purple bar is. The system is improving. Many people instead felt that the system was either staying the same, stagnant, or getting worse. By the way, those improvement reports are much lower than in low-income countries, where many people are noting improvements in their health system. Now, turning to the blue bars, you see the current health system being graded here. And here we see very low ratings. And in particular, what I want to point to is that in Italy, about 1/3 of the population felt that the current health system does not need major reforms. In the UK, this was only 15% of the population, and in Greece, it was only 11% of the population that felt the system was working well as it is. Next, please. So I think a reasonable question is, what drives this confidence, this health security or endorsement? And obviously, it's a range of factors. The quality of the health system and what people see with their own eyes and hear from their neighbors and their family is a very key factor in terms of building confidence, but so are individual demographics. We know that people's gender, age, education, wealth, and also their health determines how they're feeling about the health system. And finally, we can't forget the political and social context that health systems live within. Many people associate the health system with the current government in charge, and so their political perspectives might also color their assessment, as well as crises, pandemics, and economic and other challenges in the country. Next, please. So, thank you. Perfect. So what do we see in terms of health security? Who feels health secure among our respondents? Well, what we find is that the educated, the healthy, and people who are familiar with the health system feel on average more secure in the health system. And people who are lower income, women, people with chronic disease and unmet need have a lower sense of security. And then next, please. And in terms of the endorsement, who is supporting the health system, what we find that I think is quite concerning, and we'll come back to that, I hope, in discussion, is that it is the young, people under 30, the educated, urban dwellers, and people with unmet need who are less likely to support the current health system. Next. Okay, and actually, let's skip this one. Oh, yes, thank you. Perfect. Sorry, let's go back up one more. Wonderful. So when we did multivariate regressions, which are ways for us to understand how these factors might function in terms of producing confidence when controlling for people's demographics and gender, we put all the countries into one model. And even controlled for the country context in which people were responding from. What we found was very important in people's confidence was the quality of the public health system in people's own country, as well as the extent to which governments were responsive to the population's input about the health system. And that's what the 4 to 5 times means, that people with a high quality health system were much more likely to be confident in the system as a whole. And people with who felt that the government was responsive were 3 to 7 times more likely to be confident in their own health system. Next, please. All right, so just to sum up, we find that on average, just half of the populations around the world feel secure in their health systems. And I want to point out that this includes countries that have already achieved universal health coverage. And I think this is a really important insight because we measure universal health coverage through service provision, but the People's Voice survey measures universal health coverage through people's own sense of security, which is a very important aim of UHC. Endorsement was very low in Europe of the health system, particularly so in UK and Greece. Although Greek participants, for example, felt more positive than Britons in terms of the recent changes in the health system. So we feel it's very important to ask about the system's performance today, but also the direction of travel. As I already mentioned, more educated and younger respondents reported lower confidence that they could get and afford care if very sick. And overall, 3/4 of populations globally want to see major reform or complete overhaul. And those who are educated, urban, or higher income are especially keen to see a major overhaul in the current health system. It suggests that the current UHC models are not being seen as working for many people. And what I want to just point to is the potential danger that this might elicit or highlight, which is that if we don't have the support for the health system as it stands today, and particularly among the higher and urban and educated income groups, we need those groups to be able to pool funds for the health system. If we don't have that support, what we face is a fragmentation of the social solidarity that is a prerequisite for pooling funds for National Health Service. And I think there are a couple of ways to look at the PVS results. One of them is that there's a lot of bad news. And another way to look at this is that it may be a mandate for health system reform in many countries. Next, please. And I just want to end by inviting all of you to join us in a conference that we're hosting this fall in October 29th to 31st at Washington University in St. Louis, where we're going to be discussing the People's Voice Survey, and we will be discussing the brand new science that is emerging in health systems that takes people's perspectives into account. So hope to see you there. Registration is now open. Thanks so much, and I look forward to the discussion.
Thank you, Margaret, for these really fascinating results. From getting data we see really from users and non-users, really population-wide data on how people perceive their system is really key. And we see how getting the understanding or a more deeper understanding of how quality of care links to overall perceptions of the health system is really key. It requires nuanced interpretation. We need to understand what health systems reforms are happening in these countries. And I think when we look at Greece and the UK, and we'll hear soon about Romania, I think that helps also policymakers to get a sense of what the pulse is on how people feel about overall reform processes in countries. And so this is a key component of performance assessment. We'll hear more about this and do a deep dive into a couple of countries, Greece and Romania, that the WHO Athens Quality of Care Office was involved in for the People's Voice Survey. We'll be hearing from the head of the WHO Athens Quality of Care Office, Joao Breda, Special Advisor for the WHO Regional Director for Europe, and also the officer in charge for the WHO Country Office in Greece. And he will be followed by Suzanne Caray, a senior consultant from the Athens office, who is the coordinator of the PVS work from the Athens office. Over to you, Joao.
Thank you very much. Congratulations to our colleagues in the observatory for this initiative. Really very well done. And as you can see after the fantastic presentation by Professor Kruk, it's obvious that we would be enthusiastic in terms of understanding more the perspectives of patients and their families when it comes to health systems, and particularly when it comes to quality of care and patient safety. Once we initiated the project here in Athens, we always considered that the perspectives from patients and their families was not properly or entirely well addressed in the context of the different evaluation and frameworks and the way people were looking at the health systems. Therefore, we really felt that we need to do more, and this is why we actually embrace entirely the People's Voice Survey, because it's really novel in the way it approaches and asks the questions for those who matter the most, which are those who are served by the health systems. So we really appreciated the perspective and the way it was put, as Professor Kruk so eloquently explained to us. So let me have the first slide as the second one, actually. And why was that? I mean, we understood that in terms of quality, patient voices, patient experiences are not entirely well addressed, and we need to do more in that context. And we've been taking steps in that direction in the support we provide to member states. And that was recently confirmed by the quality of care report, the report that we launched last December. You may be aware of it. It was a report that was basically making a first evaluation of the progress in terms of quality of care and patient safety in the region. And obviously, one of the areas we looked at very carefully was the area of patient engagement and patient experiences. And we really confirmed that much more needs to be done. So only about 1 out of 3 countries actually had indicators that would report on people-centeredness using different, let's say, inquiry methods. And further than that, we also realized that basically no countries include the perception of non-users. So this was really a call for us to continue to use the PVS. So PVS is really a valid tool. We believe that it should be used on a positive way, not as Margaret very well pointed out. We all know, I mean, people will complain. There are negative things, there are challenges, but there are also opportunities. And taking it from a dynamic and positive perspective is something we would very much like to do. For example, repeating the survey in the next years in some of the countries and try to understand the dynamics around all of this. This is really paramount for us, and it's one of our priorities. And the next one. So basically, we're not great fans of doing this for the sake of doing PVS and understanding what people actually think about the system. We're doing it in the context of supporting the reforms that are taking place in these countries and accompanying other initiatives and other processes of transformation. And in Greece, notably, this was done in conjunction with the development, the first stages in the development of the National Strategy for Quality of Care and Patient Safety, which was actually launched very recently, a few weeks ago. And in Romania, we did it in the context of working together with the government in the context of reforming the hospitals towards quality of care. And at the same time, we developed innovative small set of indicators to look at quality of care in terms of the services provided by hospitals. So really about doing it in a way that it's meaningful, takes up the positive elements and helps countries with transformation. Over to Suzanne.
Thank you, Joel. Very happy to be here. I will now walk you through some of the selected findings from the People Voice survey in Greece and Romania, focusing on people's perception of the health system quality, confidence in and endorsement of their health system. Next slide, please. In Greece, there is a clear divide in the quality perceptions between the private and the public health sectors. Here you can see that while 74% of respondents rate the private health system as good, very good, or excellent, only 37% say the same for the public system, which is just about half. This gap widens when considering only the highest ratings. 31% of respondents describe the private system as very good or excellent, compared to just 9% for the public system, which is a threefold difference. You can see that Romania follows a similar pattern, though with slightly higher overall ratings and a somewhat smaller public-private gap. Next slide, please. People tend to rate the quality of their own care higher than the overall health system. That is, Margaret already mentioned in her talk just now. However, there's still a marked difference between public and private settings. Here you can see ratings for 2 key quality components: availability of supplies and equipment, and provider skill, with public sector ratings in light blue and private sector ratings in dark blue. And you can see that the private sector has consistently higher ratings, except in Romania, where provider skill ratings between public and private settings are nearly identical. Next slide, please. Reiterating on already what Margaret talked about, the people's confidence in being able to access quality health care, that varies significantly between Greece and Romania. 43% of people in Greece and 57% in Romania believe that they can access good quality care if they become seriously ill and need it. But however, financial barriers are a major concern, with only 26% in Greece and 48% in Romania believing they can afford good quality care. Just 21% in Greece and 34% in Romania feel confident that they can both access and afford care, which highlights a significant gap in perceived health security. Next slide, please. This number you also have already heard from Margaret. Only 11% of respondents in Greece and 17% in Romania fully endorse their country's health system in its current state. Meanwhile, 74% of people in Greece and 67% in Romania believe that major changes are needed. A complete rebuild is requested by 15% in Greece and 16% in Romania, which overall is a quite strong indications of the people's call for reform in both countries. Next slide, please. The outlook on the health system direction or trajectory differs between the two countries. 40% of people in Romania believe the health system has improved over the past 2 years. By contrast, 40% of people in Greece feel that the health system has deteriorated. Next slide, please. Having a usual source of care is linked to greater health system endorsement and higher uptake of recommended preventive health services. In Romania, 84% of the population actually has a usual source of care, 68% in the public sector and 16% in the private sector. In Greece, nearly 50% of the population reports having no usual source of care, which can indicate quite a concerning gap in relation to healthcare continuity. Next slide, please. Recognizing the benefits of having a usual source of care, the Greek government has recently introduced a personal doctor system. To assess the uptake of this reform, we included additional questions in the People Voice service only here in Greece. 57% of respondents indicated that they had registered with a personal doctor. However, among those registered, 57% reported that their usual source of care was not their designated personal doctor, which highlights the gap between the policy implementation and the actual change in healthcare utilization, and it would be therefore quite interesting to monitor the uptake of these reforms over the next few years with a repeat PVS, hopefully, as Joel mentioned. Next slide, please. Now, my key messages. Over 4 out of 5 respondents demand either major changes or a complete rebuild of the health system, which really suggests a call for reform. Second, public health services receive significant lower rating than private services, and this public-private gap may actually be part of the problem and eroding trust in the overall system. And third, we hope that the People's Voice survey can be institutionalized and conducted every 3 to 4 years to assess uptake of reforms and monitor health system performance from the population perspective. At the moment, you heard that only people over 18 years are included. Future waves should include adolescents as well to gain a more comprehensive understanding of healthcare experiences also of this age group. Thank you very much, and I'm looking forward to the discussion.
Thank you, Suzanne, and thank you, Joel. Really fascinating results there in terms of population perceptions of how the system is actually doing vis-a-vis all the reform processes that are ongoing. And it makes me wonder, and I'm going to sort of throw this out to our audience as food for thought before we go into the next speaker, is how we respond to, as policymakers, how do we action or take action on some of these results? Like 4 out of 5 respondents want major changes in the system. And when we have patient-reported data, the action is a little bit clearer, because we know that if the patient has a low perception of their quality of care, we need to make some changes in the quality of care within the health services of the nation. Now, if we have low endorsement of the system and low confidence in the system, then probably some of the interventions that we need to take to improve performance in those areas will be more in other health system functions. So rather than only in service delivery, which is important, we would probably have to do a lot more, for example, in the governance function and in the health system governance function, and look at how the system is steered and governed. We saw from Margaret's presentation that one of the key drivers of confidence and endorsement is general perception and trust in the government and in public services. So that's a bit of food for thought for all of you, and maybe we can have some time to discuss later on. Now let's hear from our final speaker, Günther Fink. He's a professor of epidemiology and household economics at the University of Basel in Switzerland and leads the Household Economics and Health Systems Research Unit at the Swiss Tropical and Public Health Institutes. And at the moment, he's coordinating the PVS in Switzerland. So Günther, tell us a little bit about that, and also overall in terms of the plans for the future for the PVS. Over to you.
Thank you, Deepa. Good morning, all. Thanks for having me. And a great pleasure to be here. You've heard a lot about the PVS already from Margaret, Susan, and Xiao, and I don't want to add too much more about the technical content here. So just a few reflections. It's been, I guess, now 5 or 6 years that we started this project under Margaret's lead, and it's been quite amazing to see the PVS grow over time. To me, these surveys get more powerful the more countries participate, and I think we are now approaching 20 countries and can produce all of these amazing graphs, which I think are quite powerful because in a way they create this kind of race between countries. And I think it's much more powerful to say that, say, for example, Germany does better than Switzerland than just to present one study at a time. And I hope that the Quest and PVS network can grow over time and have ever more countries in it, so we can make comparisons and see in which dimensions countries do well and in which dimensions countries really have to improve. I'm currently involved in a new study that's funded by the Transforming Health and Care Systems project by the EU, and we are doing PVS in 4 countries. That's Latvia, Netherlands, Scotland, and Switzerland. And as Susan already mentioned, we are trying to extend the scope in 2 ways. One, we're trying to add adolescents, which we think are a particularly important population, and one that has special needs. And the second is immigrants, which I think are a quite large share of the population in many European countries and often are not easy to reach and often also have needs that are not as comprehensively addressed as the needs of domestic populations. Both populations, as you can imagine, create problems starting from ethics. It's harder to work with migrants. It's harder to work with adolescents. And also in terms of reach, so we're exploring new survey modalities from paper surveys, from reaching out to networks, from working with online panels that particularly focus on these age groups. And we are learning how to do this. And I think this next generation of surveys coming from this project, I think will be quite interesting, while of course we still try to cover the core population, which Margaret mentioned in her reply online, typically covers like 1,000 to 2,000 people. I think the survey as such is working really well so far. And as you can see from all the slides today, there's lots that we have already learned. To me, extending the population, I think, is an important next step, just to say more and maybe also to be able to address questions that are country specific. And then, of course, ultimately, to track progress over time, we need multiple waves. I think Margaret mentioned it, Susan mentioned it. To me, having a PVS done in targeted countries every 3, 4, or 5 years will be a super powerful tool to track progress over time, to also identify new issues, and essentially also to make sure we can be like an organization or as a tool, we can increase accountability at the political level. So in that sense, I think PVS has been a great step in the right direction. And if we keep having these surveys in countries, I think we'll really have new data that can help us improve the systems and help also politicians and policymakers identify areas of improvement and work with them for finding solutions to address these gaps. With that, I will end my comments here and look forward to the discussion. Thank you.
Thank you, Günther. So grand plans for the future and expansion into a lot of countries, oversampling of adolescents and migrants, really fascinating. So yes, dear audience, I think what I'd like to really I'd like you to take home right now is that from the performance perspective, we really need a good combination of all sorts of data, the supplier side data, which is generally part of performance monitoring practices across many European countries, but also that demand side data. And I'd like to emphasize there, we need very important, the patient reported data, but also non-user population-based data. And especially that general public perspective is really key, and to get a sense of how the system is trusted, if they feel it's responsive to their needs. We know that during the COVID crisis, people were more likely to adhere to COVID-19 measures in countries where they trusted the system, where they trusted the government and the system as a whole. So let's see what our chat box is saying. Erica, please give us a summary of what the discussion has been like, and if you can give us a few questions for our speakers, if I can ask all of the speakers to then come on camera as well.
Thank you very much, Deepa. Yes, a wonderfully lively chat box. Thank you everyone for your comments and questions. A lot of really interesting questions coming up. Some of the more technical ones Margaret has kindly already answered in the chat, but for some of the sort of like bigger meatier ones, one of the interesting questions that's sort of come up a couple of times is about whether or not there's a risk that this public perception of the health system is actually rooted in inaccurate information because it's coming from the media and things like this, because it's not actually necessarily the user's perspective, and what that means for the results of the survey, but also what it means for cross-country comparisons. And is there anything we need to be careful about when doing that? There's also a more big policy question, which is what can countries actually do to improve satisfaction with the health system, if anybody's got any good ideas for that. But also, what do people want? So when we're asking people about the reforms to the system, what do they actually want? And I personally would add to that, did you ask if people are actually prepared to pay more for healthcare? Are they prepared to actually contribute more through their taxes to pay for better healthcare? So I'm going to hand that over to you, and then I'm going to dive back into the chat box.
Well, maybe I could start with some of these and invite my colleagues to join. And really, what a pleasure to be with colleagues, applying these data and explaining these data and working with policymakers. And that's part of the joy of our collaboration. It's not just the technical findings, but really, what do they mean and how can we make sense of them? So I really appreciate the questions in the chat, and thanks, Erica. A question we're asked very often is, how can people really know about quality, and what is it they really understand about the health system? A few of the participants have asked, how do people know how good the private health system is, for example, versus the public, right? And I agree with you all that, of course, any one individual does not have insight into all aspects of the health system. They're not fully informed. And even if they were, even if they had personal experience, many of them are not physicians. They don't know what the latest protocols are and whether they should be getting that MRI or not. So I think that's absolutely essential to acknowledge. There is a basic information asymmetry between what users and professionals think is good care. And of course, people don't have full view into all of healthcare. And having said all of that, the users of our system, with whatever perceptions that they come into the system with, those perceptions we know from past research and a fair amount of work, not just through our team, but many teams, those perceptions are linked absolutely to care quality and to the content of care that people receive. We see that from a lot of research that there's greater satisfaction, higher quality ratings where care is in fact high. So we know that the ratings people are giving us do track what is happening in the health system. Are they a perfect representation of what the system's accomplished? No, they are not. But the first thing I want to say is they do track, and what we do get from this source of data is a unique perspective on the health system, which is in general consistent with what we find from a supply side view. But the second point I want to make, and one we've discussed with a lot of our country partners, is even if the perspective may be somewhat colored by, let's say, news media, right, or a negative story that somebody's heard, it may not feel representative to the professionals that are often in kind of defense mode of the health system. That may be the case, but that is, in fact, the reality that you're seeing in the People's Voice Survey. In other words, the People's Voice Survey gives us a reflection of the real perception that is out there on the streets today. You may not like what the people perceive. You may not think it's accurate. You may be very defensive if you're a doctor in that health system, but it does happen to be the perspective of the population. We take a lot of pride and a lot of effort to make sure that we are, in fact, reflecting the perspective of the population across the age groups, genders, and so on. And that differentiates the PVS from complaints and Yelp-like, feedback mechanisms. Sometimes when policymakers say, why should I do the People's Voice Survey? It's only going to be bad news. My answer is, what's your alternative? Are you willing to base your health system reforms on WhatsApp complaints? What the People's Voice Survey does is gives us a representative picture of where the people are today. And whether you like it or not, or whether you believe the people are fully informed or not, that is information you need to have if you're trying to improve the health system. I will just say one more thing on this, that it doesn't absolve us as health people, right, from explaining better what the health system does, having a better communication and connection with the population, and really making an effort to promote health literacy in our country so people are better judges of the health system. And one final thing is we do ask people's assessment to a standard vignette in the People's Voice Survey to have a gauge or have a sense of what they consider high quality care. So we are able to control for that if we wanted to. But I do here want to defend the fact that you can improve the health system if you do not know what users are thinking and feeling about it.
Yeah, if I can just maybe add very briefly, in terms of the health system's performance paradigm, we're not saying that we're looking at population-based perception surveys uniquely to assess health system performance. This is complementing patient-reported data where we want to look at the patient-provider interaction, and of course the usual supply-side measures that are collected across most European countries in ministries of health and statistical offices in performance monitoring processes. What we're saying is that the emphasis in the past has been very strongly on the supply side, and what we need is a bit better balance, and we need to really bring in that patient-reported information and the population-based non-user reported information as well, and bring it together, and together it will give us a very good picture of performance in the country.
Maybe I could add on this one just very, very briefly. It's also about, right, what this type of study can give us is some insights on how really to engage and to involve people. So one of the examples I would like to share with everyone in this webinar is real, for example, here in Greece, by working with young people living with mental health conditions, we're really engaging with them in the design and in all the transformations that we are actually bringing to the health system. And only by taking into account perception counts a lot, and it's important. And also the views of the non-users that we can move forward. So it's really about what this survey also gives us is an insight on how to also engage with people overall, and particularly those who should contribute more clearly, the users, and particularly young people. And when it comes to mental health, totally put aside. And that really is reflected in the outcome. Thank you.
We may want to move to the next question, but just very quickly, I agree with Deeper. I mean, we are asking for people's perception, and it's only part of the health system performance assessment. And there are certainly other data and information we can collect. But I think it's also important to differentiate. For some of these questions, people are really the experts. So people will know how long they have been waiting for an appointment, whether they have been treated with respect. So I think there's no debate that people are experts on these aspects of quality. What they are less experts on is whether or not the quality they received is evidence-based and actually, impactful. So, and that is actually the most important and also most highly valued aspect usually by people. So that is a problem, but we have other means to do that. But for many of the other things, I think that people are really the experts in how they were treated.
Erica, are there further questions?
We've got time for another round of questions, which is good because plenty of questions have been coming in. So one question, probably quite a quick question, probably just for you, Margaret, but is Have you had trouble getting permission to conduct this study in different countries? And are there any plans to extend it to Ukraine, which has been undergoing quite profound systemic reforms, or any other post-Semashko systems? A big question, I think, for everyone would be, how are countries actually responding to the results of this survey and incorporating it into their policy making processes? And is there an alternative to hearing voices by actually including people directly in the policy making process? Might that kind of like democratization of health system governance, is that something you've also thought about, or is that for a different webinar entirely? Okay, so I'm going to throw those back at you, and maybe we'll get a chance for a third round. Thank you.
Well, I can briefly tackle a couple of these, but again, I would love to hear from my colleagues. We don't, there are two ways for the PVS to get done in a country, typically. One is where we have already we or a partner organization has a strong relationship with government, and government wants to know, and this is explained to them. This is a new tool, right? So it is not yet necessarily familiar to policymakers. But in many countries, most countries, I hope, the policymakers are very much involved from the beginning. And so in terms of getting permission, this is it's an academic survey. Government does not conduct it. That's actually important to us so that people can answer quite openly. But at the same time, we want government to be invested in the answers. And so to the extent possible, we involve them as a collaborator, Ministry of Health, other paragovernmental organizations get involved with us. So it's not a question of permission. It's not like we're doing a stealth move. We really do want these data to be taken up by government. And we find surprising government with data like this tends not to be the most productive. It can be sometimes. And actually, I would say that would probably be our second modality. Sometimes it is very much an academic-led exercise by local researchers. And in those cases, we still encourage them to connect with government, because while we want to understand for research purposes where people are with their health system, how people rate it, we feel that the primary use of the People's Voice survey is to help drive improvement. And so for that, you must have government aware and involved. And then I think I would just jump to the question around how these data have been used. And it's been very interesting across countries. And I would actually look to my colleagues at the WHO to fill this out for some of the European countries. But what I have seen happen is that the academics who have been working on this in countries, our Quest partners, have taken this forward, often in brown bag seminars or sort of webinars or other dissemination events with ministries of health, where they get into a discussion. There's a slide presentation, and ministries typically pose some of the questions that some of you are posing in this chat box. But with the questions, of course, being often, motivated by current events or current challenges in the country. So, for example, one topic that's been a hot topic among the many ministry discussions that I've heard about is again one that some of the users here have asked, or viewers here have asked, which is, how do people feel about private systems? What aspects of the private system are highly rated in our country? What can we learn from that for the public system? And so, so we're just getting started with some of those conversations. Gunther said that one of the strengths of the PVS is the way to strengthen it is to be done in more countries. And I agree with that. What I would say is that the more that we use the data, the more we find that near neighbor comparisons are going to be the most productive for driving change, right? And while it's fascinating from an academic perspective to compare Ethiopia to the US, very few Ethiopians or American policymakers are really going to care about that other country, frankly, in that duo. But Americans, we can maybe put America to the side for today. But European participants will care about their neighboring country, will care about the aspirational peer country that they see themselves next to, and similarly in Africa, Latin America, and elsewhere. So I think that's a very important point. So growing the range of countries that are in similar straits, similar spending, similar history and culture, and comparing performance, I think can be a powerful motivator for change. And the other one is repeating the survey over time. Again, Gunther alluded to this, Susanna as well, Joao. We think that actually the true superpower of the PVS is to track change and track the evolution of sentiment and track how people's perception is shifting. And we're very excited to do that. We have a number of surveys underway now and are looking to repeat more because we think it's that trajectory that helps to give a real picture of the evolution of the health system. Remember, health systems are not a pile of bricks. They're living institutions. And to be able to understand them, we need repeated surveys.
If I might just add very quickly here, and we had the experience in the European region, in these particular cases of working actually with the ministries of health, and it was amazing. We actually didn't look only on the negative parts, and if you read the papers properly, you'll see there's a lot of interesting elements and aspects that can actually motivate the Ministry of Health, and they took it very seriously how they can actually implement these initiatives. So I think that indeed the role of ministries of health can be important, and it can be really a motivation for them to implement changes.
If I can add, for Greece, actually, the survey was requested from the Ministry of Health. And these 2 questions that we included on the personal doctor were requested by the ministry to be inserted there, to be used actually for information how to move forward the reforms and see their uptake. And also Romania then asked us to share the data in several seminars. So the uptake was actually quite good, even if there might have been in some cases a little bit of hesitancy at the beginning, because there is a risk that there is a lot of bad news in there. But yeah, we focus today on the more critical parts. There's a lot of very positive quality ratings as well.
Great, thank you so much, Suzanne. And ideally, what we want this to do is integrate this really into health systems performance assessments overall. Gunther, you wanted to say something, please go ahead quickly.
Yes, just like a small comment, because I saw several comments online on direct involvement in democracy. And I guess Switzerland being maybe the country that has the most direct democracy, I thought it would be worth commenting on that. I think we are in a situation where people vote at everything here in Switzerland, but that doesn't take away some of the tension. Like, in fact, what we have seen here is that in general, people want more healthcare and better healthcare and more coverage, but don't want to pay for it. So whenever there's a motion for, do you want better quality? Do you want higher coverage? Of course, there's a majority for that. But if there's a motion for, well, do you want to have higher insurance premia, or do you want to have higher taxes? I think there's limits. So I want to say, like, some of the dissatisfaction comes from the high cost, and I think that doesn't go away with direct involvement in democracy. It, to some extent, actually gets worse, because then you have to deal with often misleading signals from the population, and I think that's maybe a topic for another conversation. But just to be clear, that direct involvement doesn't always solve some of the tensions that we see.
Yes, that's a fascinating discussion. Probably we need another hour to discuss, but I'd like to just tell our audience, please check out the WHO Bulletin special issue on health systems performance assessment. We will be having another webinar next week on Tuesday, but at 12 noon Central European time, on health systems performance assessment, focusing on resilience and how resilience is conceptualized and measured within health systems performance assessment. And with that, I'd like to end this webinar. Thank you so much to all of the speakers, and hope to see you next week for the next performance webinar in this series. Thank you so much, and goodbye.